Thank you for joining us today for another episode of Talks for Christ. I'm your host, Bruce Oliver. You have our promise to do our best to make the next few minutes of your time well spent. Our special guest has prepared to share a blessing with you. So let's jump in and get started. Our engine is warmed up and we are now leaving the station. Buckle up as we are beginning our Talks for Christ journey. Fentanyl is now the leading cause of death for Americans aged 18 to 49, and the crisis continues to grow. But what if there was a simple way to detect this deadly drug before it claims another life? Today, I'm talking with Mr. J.C. Sheppard, the creator of a fentanyl test that could be a game changer. How did his faith lead him to this kind of work? What obstacles has he faced? And how can Christians take a stand? We're going to cover it all. JC, would you like to greet our audience today and share a bit about your background?
Well, Dr. Pastor Bruce, first and foremost, thank you so much for having me. I definitely appreciate that. And yeah, absolutely. So, you don't wake up in the morning and say, I'm going to try to cure the fentanyl epidemic. Obviously, we wish there never was a fentanyl epidemic. But, to be quite honest with you, I worked in healthcare IT prior to getting into this of situations. And in healthcare IT, I basically was coding. It's called a CRM. It's a customer basic response system. It's where you house all medical records. It's where doctors look at all your ailments and such and come up with their diagnosis. And obviously, I think you and every listener knows how important that is to have everything accurate. So while we're building that system, I was one of the individuals who traveled, hospitals, emergency rooms, even local physicians, primary care physicians, specialists, and trained those individuals on the actual CRM, and includes patient intake coordinators. So obviously, I'm HIPAA certified, which is basically health information privacy. And unfortunately, as I'm doing in the training and such and seeing all these records and who's being admitted, I found, and it was a striking aspect, most 25-year-olds, I'd say about 85 to 90% of them were coming in for only car accidents, which were way less than fentanyl poisoning, and the second was fentanyl poisoning. Literally, it seemed like more than 65 to 70% of everybody under 25 was either admitted or passed away due to that poison. So I wanted to come up with something. There's a company headquartered in Pittsburgh that I've worked with for a very long time that was in the drug testing industry, and we came up with a test that not only, can test down to 1 nanogram, any surface, any substance, but it also does not dilute the substance. So unfortunately, you never want to say, go ahead and use drugs. That's not what we're saying. We're not saying go and use drugs cleanly. However, we cannot be naive enough to not believe people are going to use drugs. And obviously, we're not going to be naive enough either to think we can cure addiction. I truly believe only God can cure addiction. And through a person and their faith in God, they're going to cure addiction. But it's something that we wanted to come up with to where people would actually use the test if they're conscious about their health. And right now, pastors, we're seeing that 87% of the deaths you see reported in the media, which they all call overdoses, those are actually poisoning because they're taking something they do not know contains fentanyl. And this is coming down to the 22 children that we're losing a week. We're losing 22 adolescents per week right now to fentanyl. Most of them are trying something for the very first time. It could be a pill form. So we wanted to come up with something, again, that is the only one in the world that does not require users to put their drug in water, to dissolve whatever they're doing. Because not only will drug users not do that and they won't get the benefit of the test, they also end up becoming intravenous drug users and shoot that into their veins because they need to get their hit or their fix, so to speak. So that is honestly, Pastor, how I fell into this.
Wow. Thank you so much for that information. That was very enlightening, and you have a very interesting background. And our listeners are going to enjoy this today. Well, let's get on with the next question. JC, you've created a test that could save thousands of lives. How do you see this as part of God's calling on your life?
Well, to be quite honest with you, I think everything is positioning. It's almost like a chessboard to where he's putting you in specifically the places that you should be, need to be, or even in some cases want to be. And so at that point in time, I didn't set out to work in healthcare. I didn't really see myself doing anything. It was pretty much just a 9-to-5 job, paid well, of course. And it's an interesting story, though, when it comes down to it, because first and foremost, working in healthcare IT, my team was also tasked with getting 130,000 COVID tests out to our primary care physicians, because if you recall, in the beginning of the COVID pandemic, the only place you can get tests was at your primary care physician's office. Couldn't go to a Rite Aid yet. You couldn't go to the drive-up, PCR tests and such. First and foremost there, I think God led me to realize how evil our government was and how evil our hospital administrators were, because we were tasked with a job setting up a test. We didn't know what the test was for, and we also needed to set up testing protocols where we reported directly to the county health departments for our areas where physicians were located. And I never equated to me, obviously the name was COVID-19, but how did we start this project in September of 2019 when nobody in America knew what COVID was? And then how did we find out, too, when our doctors started calling me, because I'm the type of person that gives them a phone number and says, hey, call me directly. Here's my card. Don't worry about calling the 800 number to get service. Just call me directly. I'm the one in your office. I will help you. And I started getting doctors calling me and saying, all of our tests are coming back positive. I mean, literally 99 to 100% of them are coming back positive. And that's because we were only testing for any type of coronavirus, which I would imagine right now, Pastor, you and I have at least one in our body, which would have made that test positive, which that led to the pandemonium, that led to the panic, that led to the disasters that came with COVID. So that gave me enough to leave my position because I didn't believe it was honest. I couldn't understand how I knew about this 4 months before anybody in America knew about it. And to this day, I will never believe that much of anything was honestly reported, or not believe that this was put in motion by some very evil people in the world. So I really believe that's how God put me on this path, because I was there. I obviously noticed something with the COVID situation and testing situation and how our government was working with that. And that led me enough to take the initiative to start the fentanyl test and go out and try to change a real pandemic and a real epidemic, that the only way we're going to change that is to detect the substance first and foremost and teach people how to stay off of it.
JC, your announcement quite eye-opening. Okay, was there one defining moment that led you to realize that God wanted you to create a fentanyl test?
So I think maybe, Pastor, after the fact, because, I look out there, and now it wasn't easy for us to do this. There's a lot of hardships, of course. There's a lot of challenges. Getting something with our urine testing FDA-cleared takes a very long time. Sometimes you have to question even the motivation of the FDA involved in something like this. But I think really after the fact, because if you look at something if you look at everything else out there and then you look at our test, there is a stark contrast. I mean, we're the only test in the world to reach the 1 nanogram per milliliter cutoff level, which is unprecedented. That's enough to show down to a grain of salt in any type of drink, and any type of powder, and any type of broken up pill, gel, even surface on a person's clothing, on their skin. If it's on your skin, you're probably going to be in trouble. But, it's something that you look at the contrast of every other test. Ours is, we launched it in May of last year, and there's nobody even remotely close to getting to the levels of technology that we have and the levels of, accuracy that we have. And the fact that we're the only test still that does not require dilution of that substance, where addicts will actually use it and save their life. I do think, after the fact, because the challenges of going through and making this and getting it all done and manufacturing takes a lot, and really gets your focus sort of away from that. But now, because there's nothing even remotely close to us, and there's nothing even down the line coming out remotely close to us, I do see how special that was, and I definitely believe that God engineered that.
Well, thank you so much for sharing, and that was a valuable contribution. I really appreciate what you just said. JC, can you describe your passion for fentanyl testing, and how has your walk with Christ played a role in this?
I'm in my 40s, and I can't probably even count on my entire limbs here and extremities that how many people I've lost from my high school class to this. These are people that stereotype that comes with this, and I don't like the stereotype, but you've heard the term junkie, you've heard druggie, whatever you want to hear. And most of these people were never even like this. They fell into something, they got into an accident, they broke an arm, they took pain pills, got addicted to it. And that was an eye-opening fact in the first hand. I mean, we knew about fentanyl probably for, I'd say, 9 to 10 years now. And when I started seeing it pop up again in, my work in healthcare IT, that was just enough. And we're talking about children. This is the fastest growing killer of adolescents aged 14 and under right now. And again, we're losing 22 a week. So if you think about that, and I've met so many parents along the way, I've done so many conferences, I've done rallies to where, you meet these individuals that are wearing literally billboards around their neck of their child or children. In some cases, 2 or 3 children have died on the same substance, same batch, even together. And I just find that that is the absolute most evil substance in the world. The cartels getting it here, China getting it in here through the cartels, drug dealers not caring about it, all being circulated around money. So that truly, I believe, again, is how God has positioned me in this, because it's not just seeing a problem, it's seeing the root of evil behind the problem. And, now I have an entire network of people who have stepped up to help us. We're talking millions of followers that believe in the same things we do, that are Christians, that want to do God's work through saving lives, and I'm very blessed for that.
What an insightful observation. JC, fentanyl is the number one killer of Americans aged 18 to 49, as we both have said. And can you list one of the profound ways you have been a part of this solution to this crisis?
Well, unfortunately, definitely why we need God's intervention here, but we're having difficulty breaking it into the states, because if every state utilized this in harm reduction, the states are passing out the tests right now that have dangerously close to lethal cutoff levels. You have to have a deadly amount of fentanyl in your substance to even find it. And also they pass out tests that require the drug user to dip their substance in water. And let's just be honest here. Everyone knows somebody who's been addicted to drugs. Almost, I would imagine, everybody knows somebody that has passed from fentanyl, or at least an overdose or a poisoning. But when it comes down to it, drug users are not going to use those tests. They're not going to say, I'm sick, I need to get my cocaine, I need to get my heroin, I need to get whatever I need to get in my system that they think they physically need and mentally and emotionally need, let's be honest. They're not going to dip that substance in water. They're not going to wait 10 hours to dry it out, and they're not going to take the chance of that not working because of the water. So truthfully, we need the states, we need the federal government to get these out in full force, grab them from us and pass them out to the people that need them, like they are right now with these faulty tests. And then truthfully, within 2 years, we can cut 85 to 90% of the fentanyl poisoning deaths out. Poisoning is very different than an overdose. An overdose is where individual actually seeks out and knows they're using fentanyl, whereas poisoning is they're just taking a tainted substance, they don't know that it's there. Now, we find, Pastor, that roughly 80% of the individuals that are actually seeking out fentanyl, a lot of them are in the end stages of addiction. And what I mean by that is they can't even feel heroin anymore, because it's just not enough to get their system to feel it first and foremost, and also to not have them withdrawal. We find that most of these individuals are moving to fentanyl that are on probation and parole or even in prison because they're not being tested. So that's why we also came up with a urine test. That's the first FDA-cleared urine dip card test, to where even over-the-counter parents can test their kids and know within 5 minutes if they are using something and using fentanyl. And also institutionally, they can use this. And we're actually finding, too, it's a little macabre and morbid, but we're finding medical examiners now buying these because they have to wait 2 to 3 months for toxicology reports. And that's because, unfortunately, medical examiners don't put, I guess they term them as junkies, at the top of the list for results. So medical examiners are actually using our urine test to extract urine from the victim and then getting results within 5 minutes, and then going to a judge with that FDA-cleared result based on the fact that, hey, this person was poisoned. So we've tried every single angle to get these out into every possible way we can. We're finding it very hard to do because people have contracts with these other companies, but we're trying to educate them and spread the awareness that what you're doing is not working, and they can just look at their own numbers and see that's not working, because we're losing. The reported deaths are between 75 to 130,000 a year, but here's the real number when it comes down to it, Pastor, and I think everyone should definitely listen to this, is we're losing how many homeless people a day to fentanyl? Probably over 300 to 400 there alone, and those people are never autopsied, so they never at all get factored into the system of how many people we're losing on a daily basis or a yearly basis to fentanyl. So we will make a major impact. To answer your question, I'm sorry that was long-winded, but we are having trouble having states see the need. And one of our major blessings was we were down for the inauguration, and we were a sponsor of Make America Healthy Again, because obviously you can't make America healthy again without stopping this epidemic, the number one killer of Americans 18 to 49, and the fastest growing killer of children, without obviously stopping this epidemic. And so I got a call. This is definitely God too, but so we were stuck in D.C. It's kind of a funny story, but we were stuck in D.C. All the streets were shut down for the inauguration. We finally got back to our hotel and were able to leave the hotel around 5:30 or 6 in the morning, just laid down to go to sleep, and then my phone starts blowing up. I mean, legitimately 3-4 calls, and I'm like, who is this person? I've never seen their name. Why are they calling at 6:30 in the morning? So I take the call, and it's Bobby Kennedy's Secret Service. Bobby Kennedy's Secret Service called me and said, I want to meet with you because we want to stop the fentanyl epidemic in its tracks. So that's a major blessing. That was about 50 days ago now to actually, maybe it was 50 days exactly, but that is one of the ways we get this done is Bobby Kennedy, he offered to write letters to every single governor strongly suggesting that they use our test because, as a recovering addict, he's almost 30 years or maybe now is 30 years sober. He was a heroin addict. He knows for a fact what these people are going through, fighting their addiction first and foremost, being sick from their addiction, and he knows that what they are using right now will not work, and he knows that our test will work. So that's what we need. We need politicians to stand up. We need to get people really sick of watching their constituents die and their constituents' children die and get behind our testing.
Well, thank you so much for the education. And you just explained a God moment in your life where God intervened and had the Secret Service contact you. That's just a very powerful witness for your ministry and what God is doing. So thank you very much for sharing that. And, kind of just shared some of the obstacles that you've been dealing with. And for some reason, I want to have you drill down just one more time, a little bit deeper on an obstacle. So moving forward, I'm curious, do you have another obstacle that you want to share with our listening audience that was in the way, so to speak, of getting this fentanyl test out there?
We do. And unfortunately, and it's what many believe is the root of all evil, and that is money. Because our tests are so far advanced in technology, they obviously cost us more to make than what they're normally, paying for these tests that are just, again, completely worthless. The tests that they're using right now, they, again, don't work. Nobody wants to use them. If they do use them, they stick a needle in their arm with the water that they mix their substance in. And we're finding tests like that are 10 to 15 cents cheaper than ours. And we're trying to get the word out that they're putting 15 cents ahead of, your children's and your lives. And that's a major obstacle to us because there's nothing we can do. It obviously costs more for us to make these tests, and there's great aspects to it. There's so many money-saving aspects to it because the individuals I talked about probation and parole, pastor too, they don't understand the money-saving aspect and the life-saving aspect because they're not testing probation and parolees right now or anybody in prison for this because their lab costs are generally $350 to $700. So we partnered with our own lab to where we can sell the urine testing side of things with a lab backup for as low as $9.99. So they would save more money with us in the long run. But that challenge, seeing them seeing just one test costing 15 cents more for the harm reduction in terms of testing substances and not seeing the value of where an actual addict or a person that's using will use this because it's not going to hurt their substance. That is our main obstacle, is getting these states to understand that they do need to make a change.
Thank you, JC. That was very helpful to understand what's going on out there. Now, fentanyl has infiltrated schools, workplaces, and even churches. How can the body of Christ respond in a way that reflects both justice and mercy?
That's a very good question. I mean, first and foremost, I think the most important thing from church down to actual families and certainly schools, anybody who can educate, and certainly pastors do that, it really starts with educating the community. It's really educating your flock, to be quite honest with you. People need to understand that their kids are going to make mistakes. There's peer pressure. There's so much that can possibly happen. There's many people who have made mistakes in their lives, and obviously God's going to forgive them for that. But that's the thing. They have to understand that these things could happen to anybody. Most people are going to write it off that, this will never happen to my child. This will never happen to this. There are people legitimately taking what they think is a psych pill, like a Xanax or an Adderall, and they're dying because it has fentanyl. It only contains fentanyl. So I think it all starts with education and awareness and certainly parents and school teachers teaching their young. And I'll be honest with you, Pastor, when we had health teachers, or at least when I had health teachers, they scared the heck out of us with all that could happen. And I think they got away from this, teaching all the other things that they're teaching, 561 genders. Of course, I'm being facetious, but I don't even know the number that they teach. They went away from what actually mattered, and that's keeping kids off of substances. It's keeping kids aware with rational thought to say, hey, this could happen. So I really think it's important. I think churches should get involved with us and have these on hand to state that people make mistakes. We've all made mistakes in our life. If you're in a situation where, you feel pressured to do something, here is a test that you can test whatever that substance is, and it's not going to harm that test at all. You will not be uncool for doing this. Any issues that they have with wanting to test something, you have to really get it into their heads that they could save everyone's life that's involved with them. And I think that's a great way for the church to get involved. Now, in terms of punishment and such, that's obviously going to be a very, very fine line at all times in terms of capital punishment and things, but it's almost impossible to get this stuff off the streets right now. I think the administration now is doing a great job, closing up the borders and being more active certainly at the borders and making those countries more active on their own border. But the problem is there is probably enough fentanyl to kill each and every one of us in America 20 times over already. And it's not going to go away unless we truly teach people. The best harm reduction, doctor and pastor, is not using, and that's what we need to teach. We have the fail-safe in terms of testing if they're on hand to where a parent can give this to your kid. If you're ever in trouble, if you feel like you have to do something, just try to use this first. As hard as it is to say that, it's necessary now because of the evils that have been thrust upon us.
Let's dive into this next question. And the Bible calls us to be watchful. In Proverbs 4:23, it says, "Keep your heart with all diligence, for out of it spring the issues of life." You've really been zeroing right in on my question before I give them to you. You're doing such a great job. You're moving this right along so well. But I want to zero in on something that's sort of where you were heading, and maybe you could just add an extra comment, and then we'll go to the next question, because you've been doing an outstanding job helping us get an education on this subject. And the question that I'm trying to pose here, how can Christian parents do something specific for their kids against this fentanyl epidemic? If you were talking to a parent, what would you say to that parent that they have got to help fight against this? There must be something.
There is something. I mean, first and foremost, they have to realize that they're not going to be a perfect parent, even they can be the perfect parent, but it's not going to matter. I mean, now, if they're homeschooling and such, yes, they have a much better chance, but great parents have children in public school where they are opened up to so many different things. Peer pressure, lots of different types of pressures and psychological aspects that literally manifest their thoughts into saying, well, I have to be cool, I have to try this, or I want to be seen as this person. And it's so important that they understand that their child is very likely to make a mistake. And they have to make sure that they make their child understand that one mistake can be fatal. And generally, all these 14 and under children that are dying, 22 a week right now, that is happening on their first try of a substance. It's generally them sharing a pill, breaking a pill up, however they're going to use that. And that is what they have to really beat into their kids. That this isn't 40 years ago. Even marijuana is being laced with this. Some people, view marijuana as, quite innocent. And that's not even innocent anymore. The innocence has been taken out of the world by fentanyl and this deadly illicit substance. And that's really what I think the parents have to do, is sit their child down and say, look, you are going to probably make a mistake. Some kids will just go against what their parents say just to do it as well. And I hope that's not the case for anybody listening. It does happen. If they can just arm their child with one of these tests, again, state that, look, people are dying because they're trying something. If you are going to do that, use this test to make sure you don't die. It's hard for me to state that, but it's something that has to happen or you might lose your child.
Well, that brings me right to the very next question, and thank you for such a great answer on such a difficult subject. And this is going to be a difficult question, but I think that you are the man that can answer this, at least in some perspective. What is your message to those who have lost a loved one to fentanyl and are struggling to find meaning in their grief? What would be something that you would encourage them on today?
I would say build your platform from your pain, and truthfully, to honor your child, save another child. Get out there, talk to parents, tell them that you were in the same position as them, that you never thought this could happen. You were a great parent. You still are a great parent, but you were a great parent, and this evil still reached your child. And you can't be naive to think that it's not going to happen to you. And again, truthfully, to honor your child in the most best way you possibly can, and honor God at the same time, save another life.
Excellent answer. That was really something that I was hoping to hear from you. And, I love the fact that you said save another child, and basically as a tribute to your own child. That's powerful, and that's a great way to help parents cope with their grief. They may not ever get over the grief, but they can learn how to live through it. Is that right, brother?
It is right, and I firmly believe that anybody who loses a child should certainly find God in their life, because I think that's the only peace that they'll actually find after such.
Amen. Hey, we're having church right now. That was a great comment. Now, you've created a test, of course, that help bring traffickers to justice. How important is holding criminals accountable in this fight?
I mean, it's paramount. I mean, there are people that just have a blatant disregard for life. Anybody who's knowingly dealing fentanyl, they have a blatant disregard for life. And, you know, we're partnering with a big ministry here shortly. I can't say the name, but this individual is very powerful in his community. He has his own recovery network, and he's going to put out TV commercials and literally call out the drug dealers and tell them, because remember, they're not the ones going across the border to get, the cartel is getting it across the border. They're picking it up, and dealers don't even know what they're dealing most of the time. Some do, and those people that are knowingly dealing fentanyl and a deadly substance and taking lives, they absolutely deserve to be locked away for the rest of their life, or whatever the state feels is the best punishment for that, or the federal government. When it comes down to the local dealer, this gentleman who has the recovery network and, you know, the TV network and such, he wants to make commercials calling out the drug dealers saying, you are going to get capital punishment if you take a life dealing fentanyl. We now have a test for drug dealers to use. Test your substances that you're giving out to people and selling to people. Make sure you're not killing anybody, and at least since you're doing that, you will help with the fight even though you're still poisoning people. I don't know how he's going to put that out there in terms of that, but at least their product won't kill them with fentanyl. I thought that was an interesting idea, but I can tell you God spoke through him and had him come up with that idea, because it will save lives. If the local dealers that are getting this from cartels and such do actually test their substance, they can break it up. I mean, they don't want to kill anybody locally. There's no doubt about that. They don't want to go to prison for life or get capital punishment. So basically, we really see them vicariously helping such, because they don't want, it's selfish on their own part because they don't want to go to prison, but it still will help save lives.
Bottom line is to save lives, right, brother?
It is, 100%.
On that note, I want to switch gears. We're getting closer to the end of this podcast, so I want to kind of nail down a few more quick questions. But here's one that is on a different subject that maybe you can enlighten us on, and that is, why did you create a social media app preserving free speech called Wimkin, and what are some of the challenges you may have faced with that platform?
Oh, wow. Well, so again, working in healthcare IT, it was quite easy for me to make the maneuver over to, you know, coding my own social media platform. But me having the background in COVID, knowing that something was wrong, we started a website that stood for World Must Know Now, and that's what WMKN stands for, World Must Know Now, in honor of free speech. We wanted to give people their constitutional right to actually speak freely, and we did this at the time where, you know, they were shutting down Christian Prayer on Facebook, they were censoring you, they were banning people for it. They were shutting down Save the Children hashtags, calling it domestic terrorism. They were shutting down any negative talk about COVID vaccinations and any COVID restrictions. And that's not the way. We're all allowed to have our own free will and our own opinions. And for them to have their own narrative, that's dangerous. So that's why we started this platform. Basically, it's almost the same in terms of how it works as Facebook. I mean, you have full data privacy on our platform. That's majorly different. You have encrypted messenger where you can voice and video chat just like you can on Facebook, but you actually have the privacy. You can post videos, you can live stream, you can pretty much do everything you can. We even have a marketplace. You know, we wanted to make something that people would want to use and really enjoy, you know, that free speech aspect, to where, you know, they can put prayer on there. They can talk about the fact that, hey, I got a vaccine injury. Hey, I don't agree with this politician, and not be penalized for it. And the obstacles, Pastor, that we faced, we launched in September of 2020, and by January 15th and January 20th, we were banned by both app stores, being blamed for the alleged insurrection. After we beat those app store bans, we got canceled by our banks, we got canceled by PayPal, Venmo, we got canceled by our hosts and our server companies. And then finally, after we got back up and running and fixed all of that, we had the House Select Committee on January 6th come in and try to get us to turn over every single piece of information on every single one of our users. And I invite everyone who actually wants to see that fight. You can go to my personal website at jcsheppard.com. That's JCSHE2PsARD.com. And my fight is up there about all we've done and basically how the government felt entitled to have every person's information down to credit card numbers from our plan.
Wow. Okay. Well, thank you so much for that. And I really encourage our listeners to take heed of encouraging instructions. Ladies and gentlemen, our train is slowing down as it is approaching the station. What this means is that today's wonderful podcast with JC is coming to a close. I know our listeners would like to hear a little bit more from JC, so I am going to ask another couple real quick questions, and then we'll wrap up today's awesome podcast. JC, if someone is in our listening audience today has experienced the heartache of losing a loved one due to the fentanyl epidemic and needs sources for help, what would you tell them, and is there a way for people to contact you with their questions about today's podcast?
Absolutely. I mean, so I'm always accessible on the Wimkin platform, of course, and in addition, they can go to the fentanyltest.com. They can send us messages right over there. We also have a lot of, grief counseling on the website. We have educational materials on the website, so it's not just a place to buy fentanyl tests. It's a place that actually talks about the problem, teaches about the problem, and certainly can network you in the right positions if you did lose a loved one to the substance. And there's some great groups out there, Facing Fentanyl, Lost Voices of Fentanyl, Texas Against Fentanyl. Those are three that we work with that truly, Lost Voices has over 37,000 members that have lost a person, generally a child, to this. And I promise you that you will find not just, help with your grief, you'll find hope and you'll find motivation in those groups.
Thank you so much. That's very valuable information. Now, JC, if you could share one message with every Christian in America regarding fentanyl, what would it be?
Okay, that's a very, very good question there. So, it's kind of the old adage that you can't have God without Satan. I know you've heard that certainly in your days. I'm telling you right now, fentanyl is a product of Satan, 100%. And you need to realize that it does exist, and you need to educate those in your life that it exists and how to stay away from it. And that's truly it. Through God is the only way we're going to cure this problem.
Thank you so much. JC, I would like to thank you for being our guest for a very eye-opening episode. You shared a wealth of very valuable information for our listeners to take home with them today. Listeners, I would also like to thank you for being with us on this heartfelt, wonderful podcast that we had today and listening to our very special guest. The fentanyl crisis is overwhelming, but as we've heard from J.C. Sheppard, there's hope. His work is saving lives, holding traffickers accountable, and calling the body of Christ to action. If you've lost a loved one due to fentanyl, if you're searching for answers, or if you want help, don't wait. Get informed. Get involved. And most of all, keep your heart with diligence, as Proverbs 4:23 reminds us. Now, ladies and gentlemen, I want to leave you with my favorite quote. With God, I can face tomorrow and experience His peace today. Hope to see you here for our next episode of Talks for Christ. This is your host, Dr. Bruce Oliver, signing off for now. Don't forget, Jesus loves you. It has been great to have you join us for today's podcast. Did you just receive a blessing? If so, would you leave us your comments and questions about today's subject? Check out our podcast directory and join us for another guest speaker real soon. May God richly bless you.